Hi guys, I'm Dr. Kabir Ahmed, and today in this session I'm going to discuss few important aspects regarding high blood pressure, which in medical term we call as hypertension. Now, considering the increasing trend of hypertension in today's world, it becomes quite necessary not just from the perspective of any health professional, even for someone who comes from non-medical background, it's quite important for him or her as well to understand and deal with hypertension. Now, throughout this session, I'm going to answer a few questions which many people often ask, like what actually hypertension is. Is it even preventable or treatable? If yes, then how? Then, how would you know if you are hypertensive? Like, will there be any specific symptoms? Then, many people often come and ask us, like, sir, once if I am diagnosed with hypertension, then shall I be put on antihypertensive medications for the rest of my life? So these are some of the basics which I am going to discuss throughout this session, and this session is going to be really a productive one, so you can watch it for once. So what actually hypertension is? Now, when you hear the word hypertension for the first time, then going through basic English terminology, you may be under wrong impression at first that okay, hypertension means high tension, or it may be somehow related to some sort of stress or anxiety, but that's not what actually it is. Hypertension may or may not be associated with stress or anxiety. Hypertension basically means high blood pressure. Now, before understanding high blood pressure, you should have minimal concept regarding what blood pressure is. Let me clear it out in brief. Your body inside is connected through a circuit of blood vessels which contain blood, of course, and your body inside will have lots of organs, be it liver, lungs, kidney, heart, and each of these organs will require nutrition, and they derive this nutrition from this blood. And through this blood vessel, blood is continuously flowing, and while flowing, this blood will exert a significant amount of pressure towards the vessel wall, which we in turn call as blood pressure. Now, so normally blood pressure should be less than 120 by 80, but once it crosses 120 by 80, it should be considered elevated. But the term hypertension is introduced once when the blood pressure crosses 130 by 80, and it's termed as stage 1 hypertension actually. And at stage 1, you know usually conservative management is sufficient, like diet modification, like reducing salt intake in diet or minimal exercise. But once it crosses 140 by 90, that condition is termed as stage 2 hypertension, and at that point of time, active management by antihypertensive medication is usually recommended. Now, let's say you work somewhere and you are coming back to your home from your duty. You had a really hectic and problematic day at your work. Now, when you come back to your home, you open your door, and in front of your door, you saw a lion standing. No, I think lion will be too much of hypothetical in this condition. Let us consider a snack like a king cobra standing in front of you, in full mood. Then what will be your reaction at first? Then you will be scared as hell. That's so obvious, and your heartbeat will begin to rise. And meanwhile, if you ask someone to measure your blood pressure, let's say it came out to be 140 by 90 or even 150 by 100, but does it mean you are hypertensive? No, I don't think so. So, your blood pressure may rise due to multiple reasons, like the dreaded example I just mentioned before you. Even, smoking can elevate your blood pressure. Suppose, let us give another example. Suppose you are a smoker, or maybe you don't smoke too often, or you smoke once in a while being with your old friends, or while you are in any gathering or events or parties. Suppose you are somewhere in an event and you smoked a cigarette, and then meanwhile you asked someone to measure your blood pressure, and it came out to be suppose 140 by 90 or maybe even high. Then after 10 to 20 minutes or 30 minutes, you ask that same person to measure your blood pressure again, and at that point of time it came out to be 110 by 70. So you can see that after smoking your blood pressure increases, and after resting it again came back to normal. So this is how your blood pressure will vary with situations. Your blood pressure may go high because of multiple of reasons or triggering factors, and once those triggers are removed, your BP will come back to normal. But if you are hypertensive, then your blood pressure will not come back to normal. Your blood pressure will be high persistently. Every time you measure your blood pressure, it should be high. So for defining blood pressure, two things are mandatory. One, the numerical value which I just mentioned, that it should be above say 140 by 90, and second is that word persistent or sustained. Your blood pressure should be high persistently. That is, every time you measure your blood pressure, it should be high, and at that point of time, you can be diagnosed as hypertensive. So you can see that Hypertension cannot be diagnosed just based on a single reading. Suppose you visit your doctor and your blood pressure came out to be 140 by 90, and at that point of time, your doctor can directly say that, okay, your BP is high, you are hypertensive. So, to diagnose hypertension, multiple readings are usually recommended. The doctor may ask you to measure your BP like 4 or 5 times, throughout the week. And every time if it comes out to be high, then eventually your doctor may diagnose that, okay, you are hypertensive. Now the next question is, how would you know if you are hypertensive? Will there be any specific symptoms? So the answer to this question is mostly no. Most hypertensive patients doesn't show any symptoms at an earlier stage. They may be as fine or perfect as someone else around them. They may not have any symptoms at all. Maybe they are hypertensive for last 6 years or 1 year, and they may not be having any symptoms because of that hypertensive component. So they may come to us with some other problems like arthritis or joint pain, fever, or any other problem, and incidentally we measure their blood pressure and it is found that it is high. So because of this, it is recommended that after a particular age, say after 40 years of age, one should keep monitoring their blood pressure at least once a year, or most preferably twice or thrice a year. But if you belong to risk category, like if your family history is hypertensive, your mother or father or brother and sisters are hypertensive, then you should consider monitoring at an earlier age, say at your early 20s itself. Now you may be having a question in your mind like, okay, I am hypertensive, so what's the big deal in it? I'm not having any problems at all, so why should I be taking medicines? Maybe the doctor wants to earn some money, and that is why he wants me to be on medicines every day, although I am not having any problems at all. So this may sound funny, but many people actually think like that. Taking antihypertensive pill every day may cost you like 5 to 10 rupees. That's not you know a big amount. But if you miss your antihypertensive pill for a long period of time, then you may eventually land up in such a situation that you may have to spend lakhs of rupees on your health, and even after that you can't guarantee that you will be fine. So hypertension is considered a silent killer in the sense you may not be having any symptoms, you may look absolutely fine from outside, but it's actually killing you from inside. Hypertension on a long run, suppose you are hypertensive for long period and you are not taking any medicines for it, then after 10 to 15 years you may eventually end up losing your both kidneys, and your nephrologist at that point of time may put you on dialysis, or even he may suggest you for kidney transplantation. But kidney transplantation itself is a big challenge. It will cost you lakhs of rupees fine. But even after getting a kidney, it's tough to find a matching kidney. Even suppose you got a kidney of your match, even after that there is a possibility that your body may reject that. So I mean, why take that risk? And a hypertensive patient is always at risk of developing stroke. This is not so uncommon these days, and many of you may have experienced this, that once one fine morning you got a call from one of your friend and you get the news that a particular person is no more. I mean, he's dead. Then you tend to think that how is it even possible? That particular person was too, good yesterday. I met him yesterday. I had good time with him yesterday. We had tea together. We had fun time together. And now you are saying that he's no more. How is it even possible? Then you remember that, okay, that particular person was hypertensive, but he was not taking his medicines. So if you are hypertensive, it takes too less effort from your side to keep it under control. If you are hypertensive, just visit your doctor, take your antihypertensive pills every day, and keep monitoring your blood pressure. Just by doing this much of effort, you can prevent losing your kidney, your blood vessels, your heart, and eventually you can prevent yourself from stroke. Stroke is such a devastating situation that if you develop stroke, and if you are not taken to hospital on time, then anything can happen to you, god forbid. Even though if you are taken to hospital on time, then still there is a possibility that you may be paralyzed and you may be wheelchair bound for the rest of your life. Your brain controls your whole body. The right side of your brain will control the left side of your body, and the left side of your brain will control the right side of your body. So if there is any bleeding in the right side of your brain, then the left side of your body will get paralyzed. And even if there is more extensive bleeding, then your whole body, including both of your legs and hands, may get paralyzed. So by this time it's clear to you, why is it actually important to be on antihypertensive medications. So now my sole purpose of telling all this is just to remind you that if you are hypertensive, just be on antihypertensive medications and keep your blood pressure under control and keep monitoring on a regular basis. So let's talk about the causes or risk factors about hypertension. I would like to attract your attention a bit into this discussion, because this component of this discussion is really important. Because once you are well aware with the risk factors, then you can eventually work on it and eventually prevent yourself from getting hypertension. Now, the most important risk factor overall is genetics or family history. That is, if anyone from your family, like your father, mother, grandparents, or brothers, sisters, are hypertensive, then eventually you may also land up in hypertension, and there is nothing much that can be done with it. But at least you can work on other risk factors like smoking, stress, salt intake, sedentary lifestyle. Sedentary lifestyle means it is a lifestyle that doesn't allow you too much to move. Suppose you work in office where you are supposed to sit on chair throughout the day, or maybe you are jobless, and you stay at home throughout the day just lying on bed doing nothing and scrolling down in Instagram and going through reels, or maybe you are playing video games throughout the day, watching YouTube videos, and you are not involving yourself in any outdoor activities or in any enduring sports. And adding fire to that, suppose you are eating cheeseburger, pizza throughout the day, then trust me, your lifestyle is too toxic and you may eventually land up in hypertension. And sedentary lifestyle may is associated not just with hypertension, it may be associated with other health conditions like obesity, joint problems, diabetes mellitus, and even cancers as well. Now, another important risk factor is stress. Having stress for a prolonged period of time may eventually land you up in hypertension. So I would say, try to have a control over your stress. Keep smiling throughout the day. And I often say this, that laughter is the best antidote for all sort of stress, pain, and anger. So keep smiling now. Since you are here with me till the end, so I hope you have watched the full video and you have gained some knowledge about hypertension. And also I would like you to share this video with someone else who is hypertensive, or who is on the risk of developing hypertension, so that it can improve his or her life as well. Thank you.